Hi, my name is Dr. Christopher Costa from Platinum Plastic Surgery here in Las Vegas, Nevada, and today we are talking all about FAJAS. So what is a faja or a compression garment? Exactly what it sounds like. The purpose of your faja or compression garment is to add compression after your procedure, which will help with your overall healing, okay? These garments should be tailored to you to compress the areas that you've had treated, typically with liposuction. My recommendation for my patients is that after any sort of liposuction procedure that you wear a compression garment over that area for 6 weeks. 24/7, basically only removing it for showering or to wash the garment. What are the benefits to surgical compression garments? So the number one benefit is that it's going to help push out extra fluid, which will help get your swelling down faster and help you start feeling better sooner. So your compression garments should give a nice compression to help remove and displace some of that fluid that is just kind of sitting there that can start making you feel hard or like it's hard to move. The second benefit is that it's going to assist with distributing your fat nice and evenly that's left over so that you get a nice smooth result. This is partly why it's so important to have really good skin quality for just liposuction procedures by themselves, is that we do leave fat afterwards because that's what helps give us that nice contour and that shape, is the fat we remove and then the fat we leave behind. The fat that's left behind, I want it to lay nice and smooth, and the only way that can happen is to have nice even compression to lay that fat down. So the analogy that I tell my patients is if you have a giant bowl of potato salad, overflowing the bowl, it looks very chunky, and that's kind of like what happens with liposuction if you don't have a nice tight skin or a good compression afterwards. So if you take that bowl of potato salad and you take some saran wrap and you put it over the top and it kind of like smooths it all out into the bowl, that's the example of, I think, like how a compression garment can help with the distribution of that fat. Now, obviously you have to have really good quality liposuction. The surgeon has to do a good job. You have to have good skin quality also to assist with that healing and recovery process. But the garments themselves really can, I think, help patients get to their final result faster, get their swelling down sooner, which means you're feeling back to normal faster. In my office for my patients, we do provide our patients with their first garment to assist in that process. And I think that you should be wearing it for 6 weeks, pretty much 24 hours a day, just removing it for showering or for washing the garment. So it may be a good idea to have more than one, but know that you will change size as you continue to heal, and you may have to change size in garments. So how should your garment fit? My opinion is that the garment should fit snugly, but not be so compressive that you can't fit your entire hand into the garments. Sometimes I've seen patients double up on their garments, wear 2 garments because they're like, oh, it's just not tight enough. And it's not meant to be like a corset where it's really like just pulling your whole abdomen in. It's just meant to provide some even, light to moderate compression. Garments that are too tight can cause complications like skin necrosis. It can cause actually more unwanted creases in areas that you don't want. So the garment should fit comfortably. It shouldn't be restrictive. Essentially, if you can get your hand inside the garment, that's pretty good. Things that can assist with the garment, especially if like you had a BBL, where we want some light compression over the buttocks to help with the smoothing of the shape, but not necessarily so much where it chokes out the fat. You may have to have a little bit larger garment to fit over the hip and the buttock area, but a little bit tighter around the abdomen. So some companies do make garments that are more customized, which can be great, but they can be very expensive. What I usually recommend for my patients is to have, like I said, a little bit of a larger garment, and then facilitate those areas where you want some more compression, like around the waist, with surgical foam that can help provide more of that even compression. The things that a faja will do I believe they will help you get to your final result faster. They will help get that swelling down, which can really help patients feel better sooner. And they will, to some degree, help a little bit with your final result with, I think, some of the smoothness of the areas that were treated with liposuction. What a faja will not do is it will not create a poor surgical result into a good surgical result. A faja will not give you the same effect as actually having surgery or doing liposuction or a BBL. So fajas themselves, it's like every other tool in plastic surgery. You know, they have some benefits and some limitations, but it's definitely not a substitute for surgery. You can't just wear a faja and get like a liposuction result. The biggest contributing fact to your end result is really just going to be on making sure you pick the right surgeon, somebody who is very familiar with what you're looking for and working with your body type. I highly recommend that look at before and after photos from every surgeon that you're considering to make sure that they're the type of person that's going to get the result that you're looking for. So thanks for tuning in, guys. If you like this video, please like and subscribe below and tune in for next time.